Hello everyone, and welcome to today's RCPCH webinar. Today, Professor Tatton Brown, Dr. Ellie Hay, and Dr. Amy Frost will discuss the exciting new GeNotes online platform, which launches this year, and how it will facilitate genomics mainstreaming for paediatric clinicians. The presentation will last for approximately 45 minutes and will follow with a live Q&A with the presenters. You are able to submit your questions throughout the presentation via the Q&A option, which can be found by clicking or tapping the question mark icon on screen. Thank you. I will now hand over to Professor Tatton Brown. Thank you.
Thank you very much, Anthony, and thank you very much for asking the three of us to come and talk today about genomics, GeNotes and paediatrics. So my name is Tatton Brown and I am Clinical Director and Head of the Genomics Education Programme within Health Education England. I'm also a clinical geneticist at St George's, and I'm very lucky to be joined today by one of my colleagues, Dr. Amy Frost, who works with me in the Genomics Education Programme and is an education lead there, and my colleague, Dr. Ellie Hay, is a consultant clinical geneticist at Great Ormond Street. So today we're going to first of all cover the fundamental principles of genomics, and I'm going to lead on that section before I hand over to Amy, who's going to introduce you to GeNotes and give you some of the backgrounds and features. And then Ellie is going to wrap up our talk today by showing how GeNotes applies to paediatrics and for paediatricians. So let's start with those fundamental principles, and I'm going to pull us right back to the very basics and really set the scene about what we're talking about. So we are talking about genes and chromosomes here, and when I talk about genes and chromosomes, particularly with patients and families, I like to use the analogy of a library of books, and more specifically a library of about 20,000 books, because we have about 20,000 genes. And in that library, those books are arranged into book stacks, which equate to our chromosomes, and we have 23 pairs of chromosomes, which are labelled 1 through to 22, the biggest through to the smallest, and then the 23rd pair of chromosomes are sex chromosomes. So females have 2 X chromosomes and males have an X and Y chromosome. And I've rather gratuitously put my favourite picture here of DNA in the top right hand corner, just reminding you of that double helix structure. And when we're talking about alterations of DNA, we think about large scale through to small scale alterations. So on the left here, the large scale alterations are those alterations that you might see when you look at the chromosomes down a microscope. So we're talking about aneuploidy, so abnormalities of chromosome copy number, or that's copy number variation, which moves into our microdeletions or microduplications. So that's smaller regions where you have sections of chromosomes that might be deleted or duplicated. Then we moved through to our small scale alterations, where you can have small insertions of bases or small areas of deletions of bases. And then finally, our base substitutions, where you just have an alteration of a letter. And that's our missense alterations, or an alteration of a base can introduce a premature stop codon. So I just think it's really important that you see that full scale of genomic variation that can cause disease, but that also might be part of this normal genetic variation. And whenever we're thinking about genomics, it's always important to think that this is our background. So whatever happens in our genome, we all have between 3 and 4 million variants in our genome that are mostly those small base substitutions. And these variants, most of which we don't really know what they do, but they do make us unique and we think are the basis for evolution and the basis for some disease. And we call them polymorphisms, or SNP, single nucleotide polymorphisms, or single nucleotide variants. And this is a graph that I like to use to show actually there's a continuum of these various different genomic variants that can happen from, at the right hand side, these very common variants that have a low penetrance, and this is really part of that normal genetic variation, and those variants that we think influence the acquisition of disease. And these variants are mostly picked up through genome-wide association studies. At the top end of our graph, we have these low frequency or very rare variants, which have high penetrance. And this is probably the sort of genetic variants that you're familiar with in rare disease. and in Mendelian disease. So that's where a single gene variant causes an individual disease, and if you inherit that variant, it has pretty full penetrance, so you're very likely to go on to develop that disease. So that's just an introduction, thinking about genes and chromosomes, thinking about the various different types of genetic variation that can disrupt the normal functioning of the DNA, but also remembering that that is superimposed on this background of normal genetic variation. And when I first moved into genetics at the turn of the millennium, we would really try to leverage those single gene causes of disease by testing a single gene, and that would take about 3 to 4 months to sequence, so 3 to 4 months to get your answer. But in order to choose that single gene from those 20,000, you had to have a really good idea of the phenotype. So you'd go into that library of books and think, I think this child in front of me has X syndrome, so therefore I'm going to test Y gene. But that was a very expensive, laborious process, and that's really exemplified by the Human Genome Project, which happened at the turn of the millennium, took 10 years to complete, and cost many billions of pounds to undertake. So roll on then the massively parallel sequencing technologies, or next generation sequencing technologies. And this is my second favourite slide to my rotating DNA, because on the left we have the olden Pac-Man days where we were laboriously sequencing each gene. And we've now entered the Grand Theft Auto era. We're able to look at all of the genes in a single experiment, and we can get data from all of those genes in just a couple of days and at a cost of less than £1,000 per genome. So that faster, cheaper sequencing is transforming our access to the genome and how we are delivering healthcare. And that's shown on this next slide here. So rather than genomics being the purvey of just clinical genetics, it has now moved out of just clinical genetics into many different areas of healthcare. So we continue to use genetics or genomics for the diagnosis of rare disease, but we're increasingly using polygenic risk scores to think about common disease susceptibility. And that's particularly being rolled out at the moment in the areas of oncology and cardiology. Genomics is being used in infectious disease, and we were really thinking about that, talking about that all the time during our recent COVID pandemic. And our understanding of the viral genome is what really propelled our understanding of COVID and how COVID was being transmitted. Genomics is being used in oncology, both to test the germline, but also the tumour DNA, and that's really driving forward our therapeutics. We're using genomics in fetal diagnostics, so for non-invasive prenatal testing and non-invasive prenatal diagnosis. And then we are increasingly realising the holy grail of genomics, which is to deliver precision medicine, where we have targeted treatments, we have gene-directed therapies, and increasingly we're using genomics in pharmacogenomics, so choosing the right drugs for the right patients at the right time. So in order to facilitate the adoption of genomic medicine, there's been a really big reshake of how we are delivering genomic medicine in the UK. So there's been a structure imposed upon the UK where we had, well, in England in particular, where we now have 7 genomic medicine service alliances mapped to 7 genomic laboratory hubs. And you can see the geographical divide of these GMSAs and GLHs on the map here on the right. And then each one of those GMSAs and GLHs has between 2 and 3 clinical genetics services affiliated to them. So we have 17 clinical genetics services within England. And the aim of this newly established genomic medicine service is to facilitate access to genomic testing, really democratising testing and ensuring that everyone is able to access genomic testing to really benefit their diagnosis and their management. And the Genomics Education Programme, which is what I'm leading, based in Health Education England, is really been established to facilitate that adoption of genomic medicine by upskilling at scale and pace the entirety of the NHS workforce. And we have 4 pillars within our genomic education programme, or the GEP as we call it. So our first pillar is to identify the NHS workforce needs. Second, we are aiming to build and join networks across the country. Third, and this is the real meat of our programme, is to help educate and develop the NHS workforce. And finally, we aim to increase awareness of genomics across healthcare. And these 4 pillars are underpinned by our PAGE group, or our Patient Advisors for Genomics Education, where we're really ensuring that the patient voice is up front and central, and really determining our direction of travel and what we are developing and how we are disseminating our resources. So today in this webinar, we're really going to focus on that work stream 3, that third pillar, to help educate and develop the NHS workforce. And our flagship resource in this work stream 3 is GeNotes, or Genomics Notes for Clinicians. So I'm now going to hand to my colleague, Dr. Amy Frost, who's going to tell us a little bit more about GeNotes and give some of the background and the features. So thank you very much, Amy. Over to you.
Thanks, Kate. I think the idea for GeNotes was really born out of exactly what Kate's just described, the recognition that we have made this phenomenal change really from Pac-Man to Grand Theft Auto in terms of the technologies, the options for testing, and that there are just so many more tests that we can do now. And that has actually left a lot of clinicians behind, perhaps also who trained back in the Pac-Man era, and things have changed dramatically really in the last 10, 20 years. Clinicians are amongst the busiest people we know, and people finding time to sort of proactively go out and plug gaps in genomics education knowledge, it is a real challenge for busy clinicians. So really the idea about GeNotes was that it will provide clinicians with real sort of just-in-time education when they need it, really at the point of patient care, and they realise that there is a gap in their knowledge and they need some support, and GeNotes is there to help support them in that moment. But that also underpinning that, there are opportunities for them to extend that learning experience and just plug some of those gaps. So what you're seeing here is the entry page to GeNotes. It's an online resource, and the resource is developed specifically for clinicians and developed by clinicians, so hopefully by people who know what you need to know. The point of GeNotes is that it helps to support clinicians who are both requesting genomic testing and also receiving genomic test results, and as I say, providing these opportunities to build knowledge along the way. GeNotes aligns to national priorities as outlined in the recent government implementation plan, Genome UK. It's a named commitment in the Rare Disease Action Plan. And feedback we've had from user testing suggests that clinicians really do trust the branding of the resource. They trust it because it's an Health Education England resource and are happy to see it as a source of reliable information. It's entirely free to access. So in the development of the resource, we looked at sort of limiting access and logins, but really the upshot was that we didn't want to create any barriers to access at all. So it is entirely open access website. The resource is built structured in 2 tiers. So what we call tier 1 are the in the clinic resources, and these are the resources that I mentioned that support clinicians who are requesting genomic testing or receiving those results, and they're built around clinical scenarios. So you'll have a clinical scenario that will then lead you down a certain path in terms of what you might need to know to perhaps recognise that there might be an underlying genomic condition, to work out what's the appropriate test in those circumstances, whether your patient is eligible, and then really to help the clinician with the nuts and bolts of getting those tests ordered. You know, what forms do I need? What samples do I need to send off? How do I fill out those forms? So really the idea is it will really support you along every step of the way. There are also in the clinic resources that are based on when results come back. So the patient might come back with a result from genomic testing, and really to support confident interpretation of those results and appropriately actioning clinically actionable results. And those in the clinic resources are specialty specific. So each different specialty will have its own set of bespoke resources that are relevant to their specialty. We also have underpinning those specialty-specific resources, the Knowledge Hub resources. Now, this is shared across all the specialties, and it's really an encyclopedia of resources. And here you might find information on different genomic technologies. You will find information on different conditions, also about different therapies, and also the fundamentals of genomics. So say you think, oh, I can't remember what's germline mosaicism or what's a variant of uncertain significance. These things you might want to check, you'll be able to find in the fundamentals package. So this should really underpin the more clinically facing in the clinic resources. So the infographic on this slide just shows those two tiers I've just mentioned. The Tier 1 resources are very much aligned to the National Genomic Test Directory. So you will find they're consistent with the eligibility criteria in the test directory, and they're written to a really strict template. They're short, snappy, quick resources. And the reason they're written so strictly is that when you get used to using GeNotes, it allows you to go very quickly to what you need. These resources are designed to be used with the patient in the room if necessary. You'll see on the infographic here that there's lines sort of leading from Tier 1 in the clinic resources into the Tier 2 Knowledge Hub resources. And that's because peppered through these Tier 1 resources are hyperlinks that you can click on, which will take you through to the Knowledge Hub for more information. But those Tier 2 resources, as well as being accessed through the in the clinic resources, can also act as standalone educational resources and can be assembled to make bespoke learning pathways as required. They're multimedia, so you'll find articles in there, but you'll also find expert interviews, patient interviews, infographics, animations, and we hope that they are engaging, bite-sized pieces of learning. In terms of how the content is developed, as I said before, the content's developed by mainstream clinicians for mainstream clinicians. So the content is developed by specialty working groups, and these working groups typically comprise clinicians, both consultants and SPRs from the individual specialty, also supported by clinical genetics clinicians, genetic counsellors, specialist nurses, midwives, pharmacists. So we've got representation from lots of groups, and that's really important to us because we're trying to make these resources relevant and engaging to a wide variety of different professionals. They're also multi-regional. We have representation from all the GMSAs across various working groups. So we have 11 working groups and counting. Oncology were our first, closely followed by paediatrics. And at the bottom, you'll see it says, watch this space, because as well as these 11 groups, we've got busily beavering away at the moment, creating content. There are several more in the pipeline. In terms of the governance of the content, we have a very sustainable infrastructure for GeNotes. The content development is fully funded. So there's JEP funding to remunerate both the authors and senior reviewers of the content that's developed by the groups. The published content is regularly reviewed and updated. Obviously, that's incredibly important in this really rapidly changing field. And we work very closely with the team at the National Genomic Test Directory to make sure that any changes to the test directory are swiftly represented in our resources. There's several teams at JEP that support the working groups with the content development. We have educationalists, editorial team, design, digital, project management and admin teams, all of whom provide support to the working groups. And on the next slide, you're going to see that in a nice figure, which we call our GeNotes globe. So round the outside, you'll see the different working groups. And if you look round to the paediatrics one, you'll see that the outer layer is the working group chairs. In the case of paediatrics, we have Ellie and Hay and Emil Hendricks as our chairs, and they really coordinate the activities of the working group. And then underneath that, the sort of the inner layers of the globe here are all the various teams at JEP providing support with the content development in various ways. And the thing that's missing from this diagram is a satellite around the outside, which is our wonderful comms team, who are really helpful in helping us get the word out about GeNotes and promoting its use. So GeNotes is a highly tested resource. It's had initial concept development testing, alpha testing, and then private beta testing. And so for the private beta testing, what we did was we sent groups of clinicians. We did testing in first oncology, then paediatrics, and then general practice. And in each case, we sent a user testing group of clinicians who'd volunteered to be our guinea pigs a link to a private suite of resources on the website that we developed for their specialty. And we gave them some clinical scenarios so that they could practice driving around the GeNotes resource and seeing if they could find the information they needed for the various scenarios. And that was hugely helpful for us because it gave us some really rich feedback in terms of how we could improve the resource and what we were doing right. So these are just some highlights I want to tell you about today. This is the combined data for the 3 groups. If you, to help you look at these pie charts, really, if you think about it as a traffic light, the darker green were the most positive responses through sort of neutral, amber and red for the least enthusiastic responses. So, for example, the first question we asked them about the content, was it pitched at the right level for people? And you can see that the vast majority of users either strongly agreed or agreed that the content was. So that was really reassuring for us. We then asked people about how they found navigating the website. And again, happily, the majority found it either very easy or easy to navigate the website. And we got some really helpful feedback on how to improve the search experience from the qualitative data that came out of that testing too. When we asked people how likely they'd be to use GeNotes in the future, again, the vast majority said they were very likely or likely to use it. Just to give some sort of more summary data, the system usability score is a set of 10 questions that are designed to measure the overall ease of experience of using a digital resource. And you pull them together and it gives you this overall score for how people found the experience. And our user testers tell us that the average for digital services, when you test them with this set of questions, is around 68, a score of 68. So you can see we were really pleased that GeNotes really outstripped this, achieving nearly a 90 score for system usability. In terms of our next steps, following the private beta testing, the oncology working group launched their initial suite of resources back in June 2022. So if you were to go to the Genomics Education Programme website now and follow the link to the GeNotes resource, this is what you'll currently find live, the oncology resources on the website. But we have several more specialties out of those 11 working groups you saw earlier who will be due to launch this spring. So fetal and women's health group will be the next one to launch at the end of this month, and you're probably most interested in the paediatrics resource, and that will be launching in May. We also have, as I said, several more working groups on the way. We're also developing an app for GeNotes alongside the website because feedback from user testing suggested that would be welcome to people. And the other thing that we're looking at from a technical point of view is integrating the content into primary care management systems, because general practitioners are really embedded in their use of these management systems. And rather than having a sort of second resource running alongside it, we looked to integrate it into these systems. And the website is actually has an API baked in that allows us to syndicate content in this way. So we're looking at this currently. Really, the big job from here on is ongoing evaluation. So the public beta site, as I said, is live. It has a feedback tab on it where people can tell us about their experience of using the website. And if anyone does use the website, I'd be very grateful if you could let us know if there's anything that's worked particularly well for you, or that has not worked well for you, or things you were expecting to see and didn't. That's all really valuable information for us. We can look at website analytics, look at how people are using the live site, and we'll also plan a repeated user survey down the line once a few more groups have launched, just to get some more rich data. In terms of opportunities to get involved, as I said, if you'd like to go on the link and have a look at the website, that would be fantastic, especially if you're able to give us any feedback. If you find anything that's missing, you want to join or suggest a working group, then please do get in touch. And really the best way to stay up to date with the latest GeNotes launches, which groups are coming when, and other GET news, is to sign up to our newsletter, and the link is here on this slide. Thank you very much. That's me finished. I'm going to pass over to Ellie Hay now, who's going to tell you in more detail about the paediatric suite of resources and give you a drive around the website.
Brilliant. Thank you, Kate and Amy, for absolutely brilliantly outlining there the evolving landscapes of genomics, the role of the Genomics Education Programme, and of course the aims and scope of the GeNotes resource, which we're going to be talking about today. And particularly I'm focusing on the paediatric working group. So myself and Emil Hendricks, who's a consultant in paediatric endocrinology based at Cambridge, have the role of chairs of this group. And we very quickly realised that it was a very vast bank of resources that we were going to need to produce for paediatrics, which we anticipate will be heavy users of the National Genomic Test Directory. And actually, we felt that the best way for us to be able to deliver relevant and up-to-date resources for the whole range of conditions that we see in paediatrics would be really to have subspecialty chairs. So individuals who are responsible for their own subspecialties. So that's what we've designed here. You can see in this chart. So we've got some groups which are going to be standalone paediatric subgroups. So things like neonatology or developmental paediatrics, whilst we have others which will be working with their co-part in adult medicine. So things like cardiology, for example, where you may have genetic conditions that present both in paediatric age and when they're older. And so we've got registrars and consultants who are working individually on these, and they're alongside the clinicians and that lovely globe that Amy showed earlier, really working with the GeNotes team and the wider genomics education programme to develop these resources. And all of these groups are beavering away happily now, but actually what we focused on really for our launch is a group of, I think now almost 100 resources which will be up and live from May, which we're incredibly excited about. And really because we want to be able to share with you what we've developed, but also, as Amy alluded to earlier, get your feedback. So I think next slide, Kate. And we've really seen that we got the kind of feedback that we wanted, was that actually we were not trying to deliver an encyclopedia here. We want to have clear and very easy to access content, which is relevant for that time that you are in the clinic, but also, and I think overwhelmingly we've seen on here, that is helpful, that is something you can access that you feel confident to use within that situation, and that's reliable and easy to navigate. So all of the feedback we've had so far has been very helpful, and sort of tweaks that we've had have also been useful as we're moving things forward. So yeah, as we get to launch, it'd be really great to hear how you find it useful and what we could potentially do to improve matters. And so I think it is useful to think, you know, how will I actually use this in practice? I think as clinicians, we're often given a lot of things which have been developed that people think are going to be helpful to us, but actually, you know, it's using it yourself and knowing what sort of context you're going to find this helpful. And I've split this here into the in the clinic and the knowledge base. And the in the clinic is really the when, what, and how. So if you have a child sitting in front of you, what are those situations where you might think that genomic testing would be relevant? So it's not just a child who might be small, but what are those parameters that make you think, okay, this is beyond what we would anticipate for somebody who's small within their family, or perhaps they've got other features such as learning difficulties, which would make you think that genetic testing would be more relevant for them. And then if you've made that decision, then it's what do you do next? And we know that the National Test Directory is a fairly unyieldy document, I think running to the best part of 500 pages, and nobody's expecting to have you that as bedtime reading. So it's being able to cut to exactly what you want within that. So which particular category do you want to have a look at? And then how do you navigate into that? So those are really two very important aspects of it. But then when you've decided that, yes, you need to test and what test you want to order, the next bit's also important. You know, how do you actually do that? So this is when we talk about what samples might be required, whether it's an EDTA or a lithium heparin. And then if there's a particular test which requires you to have both parents as well, so something we call a trio sequencing test. And if that's the case, do you need to have consent? And if that's the case, how do you take that consent? So it's really taking you through the entire thing so that you're not left trying to search through hundreds of websites to find the information that you need. And then the Knowledge Hub is, as Amy mentioned earlier, it's a bit like the library, and this is accessible to all of the different GeNotes groups, and it comes under different subgroups. So I think the most sort of one that comes to mind is the conditions. And I think you could access this in two ways. So that's either that you've got a child in the clinic and you think, oh, it sounds familiar. I wonder whether this is a De George type presentation, in which case you can click into that and you can find the clinical features that are most prominent with that condition. But also it's really helpful if you get a result back and think, okay, this is not a condition I know very much about, or a gene that I know very much about. And so you can go into that and find out about the inheritance model and any particular management that would be relevant to that. But it's not just limited to conditions. So we have core concepts. So are you confident in explaining autosomal dominance or genomic imprinting, for example? The technology. So do you know what the difference between an array and sequencing is, and when you might utilize each one, and potentially what could be missed in those if you get a negative result back? And then the sort of practicalities, the genomics in action. So that's the, how do I complete this test form? How do I look into completing testing? And so these are the sort of the areas which I think are most useful, but we felt that one way to demonstrate this sort of more practically would be to have a drive through of these conditions. So I'm just going to take over sharing. So this, as Amy mentioned earlier, is what we see when we come to the generic GeNotes web page, and you can see that there are a number of different featured specialties there. So we have the oncology, paediatric, primary care, and a number more that are coming in the future. So this has taken us through to the paediatric page. So here we're in the clinic, and so you can see that there's a range of resources that are organised in the table. And if you want to go by theme, so say if you were a neonatologist and you wanted to pull out all of those resources, you could click onto those theme links, or go to, say, general paediatrics, which I think is going to demonstrate for you next. And that just means that you can narrow down the resources that you are wanting to look at in that particular rundown menu on the side, or you can search by keyword. So I thought we could think about a scenario. So perhaps a 3-month-old baby who's under cardiology because of pulmonary stenosis, but actually is presented to your children's assessment unit because they've been feeding very poorly, have been perhaps losing weight, and somebody has done a scan and noted that they've got a kidney abnormality as well. So you might be assessing this baby, having admitted them to the ward, and be discussing whether or not this is somebody who you think might be eligible for genetic testing. So you can pick anything by keyword. So here I'll just take an example of heart, thinking about congenital heart disease. And you might be able to zone in a particular presentation if you recognise it, or go more generically to what we call our kind of landing cards. So these are presentations of symptoms or different features, and within them, as is set out for all of our cards, you have a title with a little bit of an explanation, and then it goes on to sort of set the scene. So really, so you can orientate yourself and see that you're in the right area. And then, as we mentioned before, when would you consider genomic testing? So it could be that you've got a child with a heart disease, but actually they need something else. So is it a family history or a particular congenital anomaly that we know is associated with genetic conditions, or something associated with a particular underlying condition, or just a mixture of malformations in addition to delay or growth restriction that makes you think there could be something else going on? And these landing cards give you suggestions of links out to other particular clinic articles relating to individual conditions, but also go down to the section on what you need to do next if you're not clear that it's any one of these diagnoses. So it will link you out directly to the National Test Directory with the updated versions that come on board, and take you out to these eligibility criteria. And you can search these if you do the Control F and put in your particular code. So they're all done by R numbers. So you could put in your R137 to get you to where you want to go directly, or you can have a look through the individual categories in the contents page under the relevant conditions. So you can go into cardiology here, for example, and see that the microarray, or the 137 that we saw on our GeNotes roster, is there, and then you can have a look and see whether your child would be eligible on those criteria. And as Amy mentioned, there's many links that go through here, both to the individual test categories. So if you weren't sure what a microarray was, you could have a look at that, and it will give you a little bit more information, particularly useful when you're speaking to parents. And where we can avoid words, we'll put a picture in, because we know that that's easier to digest. So you might have had a chat with your consultant, and actually, having looked through this resource, felt, right, okay, well, I think perhaps we are dealing with a particular condition here. And so you could look up through the menu that we had earlier and think, okay, well, this child's got pulmonary stenosis, they're feeding problems. So maybe we're looking at a Noonan type condition, and then you can go directly to that page, and it's helpfully set out in the same way, but then here particularly, it's looking at some of the features that you might see with this condition. So you think, yeah, okay, we feel like we're on the right track. And perhaps, as is often the case, if children are seen in the neonatal unit, that they've had an array already. So they may already have had a negative test. So then you're thinking about what you could do next. Now, we completely admit at the moment that Noonan syndrome is a challenging condition to diagnose in the National Test Directory if you're a paediatrician. So if they've got developmental delay, then you can look at doing the R29. But outside of that, you might need to be looking at something broader. So the R27 looks at congenital abnormalities as well as dysmorphic syndromes. And so this could include Noonan syndrome, but also wider than that. And you can particularly specify that you're looking for a condition that can help the laboratory to narrow down their search. This in particular, at the moment, the R27 needs authorization from genetics, but often that just involves contacting your local genetics unit and just explaining what you would like to do. And when you've got authorization for that, then thinking about the proactive bit. So what do I do next? So when you're requesting these, they need a test order form. And so again, this is our Genomics in Action type resource. Take you through exactly what this form involves, what's the structure, but importantly, how do you actually complete it? So it goes through all the relevant subsections, but we'll also link out to areas that are really important. So for us, particularly, these are about the patient phenotype. So being able to tell the laboratory what are the key features that are particularly important you feel in coming to explore the data and thinking about a differential diagnosis. And so again, you can link out to the HPO terms, which is the way that we categorize these, the human phenotype ontology, and you just type in your feature like low set ears, and it will give you that HP number there that you can cut and paste directly into the forms. And then you can navigate back to your GeNotes again. So you've got your test order form completed. How do you do consent? Well, this is through a record of discussion form. And again, we have all of the links out to here, and it really gives a very step-by-step guide to how you would approach testing these, if completing consent, if it's not something that you've done before. And what I quite like about this particular resource is that it goes over the sort of generic aspects of consenting, but then also for this form, because it is slightly different when you're consenting parents to this wider testing, goes through the subsections and gives a sort of statement that you can use yourself if it's not something you're particularly accustomed to discussing with families. And then if you were, say, to go and speak to parents on the ward, there's a really good resource that we've linked out to here in the subsection for clinicians that has a 2-page document that I think is one of the ones that was come out of the Health Education England that you can just print off and take with you. And it's a really good crib sheet to make sure that you've gone through all of the relevant discussion points with the families. So let's say you've managed to do your test order form, you've completed your consent on the child and both of the parents, and now you're getting the results back. So where do we find information to help us navigate those results? Well, that's in our Knowledge Hub. So if you navigate back to that main page, you can go up to that top toolbar and click into Knowledge Hub. And again, you can search by keyword. So here, perhaps you've got a gene change in PTPN11. So you could tap that in and it comes up with a relevant resource here in the rasopathies. And in the future, potentially, we're going to have some gene cards too. And again, these conditions are in a set way that we're presented. So a brief overview of the conditions themselves, what sort of clinical features you might be looking for at presentation. And often we separate these by age of presentation too. And then what's the genetic pathway for this? Is it a single gene? Is it something that could be caused by many genes such as this, or a chromosome change? How is it inherited? So again, this is where we can link out to those individual forms of inheritance. So autosomal dominant, we've got an example here. And again, we try and make this multimedia, so not just lots of text, but useful diagrams. And sometimes we've got some great resources that have already been developed for Health Education England that we can use. And that's helpful not just for you when you're learning new forms of inheritance, so perhaps ones you've not come across before, but also when you come to being able to explain this to families. And it's presented in quite a logical and clear manner. And then we've also got a little bit on management, though these tend to be very brief. This is not a management tool unless there's something specifically related to gene therapy. So what we prefer to do is to provide these resources. So we have a section for clinicians and for patients. So clinicians, we try and link out to ones that we find particularly useful and relevant, particularly to UK communities. And then for patients and often for the people that you're referring out to, we have useful guidelines that we have utilised in the past. So things that mean that you don't have to spend hours trawling through Google searches to find something that you feel is sensible and pitched at the right level. So these are just an example of some of the discern guidelines that we have for a few of the more recognisable genomic conditions. But then we also provide links for other things such as the support groups, because families find these incredibly useful when they have been given a diagnosis of a rare disease, and knowing who they can contact, particularly if there are UK relevant groups around. So then just to show you a little bit more about the different types of categories we have for these knowledge hubs. There are obviously the conditions and the technologies that we mentioned earlier, and a big long list of different ones that you might want to find more about if you're getting a test result back, for example. Some of the core concepts, so things you may not come across routinely within paediatric practice. So genomic imprinting is particularly one that causes us lots of angst when we're trying to remember the different types of ways in which these conditions can be inherited. And then, as I mentioned, sort of the genomics in action, so the practicalities of ordering some of these tests. And that will just take us back to that home page. So I think this is our last slide. I mean, we just wanted to say an absolute huge thank you really to, well, certainly to my colleague Emil Hendricks for co-chairing the paediatric working group, but all of the individuals who've contributed to that, and of course the wider members at GEP who have really made this whole thing happen. The fact that we're getting to the launch now in May is just hugely exciting, and the fact that we have more than 100 resources as well is absolute testament to the hard work of all the individuals who've been involved in this. So yes, a big thank you, and we're happy to take any questions.
A huge thank you there to all the speakers for that fantastic and informative presentation. We'll now have a Q&A with the presenters. You're able to continue to submit your questions throughout the presentation via the Q&A option, which can be found by clicking or tapping the question mark icon on screen. We do have a few questions that have come in, so I'll just put those to the group. Who is able to access GeNotes? One of our delegates has asked.
Amy, do you want to take that one?
The answer is anyone is able to access GeNotes, which is wonderful. It's completely free and open access, so you can simply go to it through the Genomics Education Programme website, or if you just enter the word GeNotes into any search engine, you will find it.
How do you get involved in GeNotes or the GEP work? One of our delegates has asked.
Should I take that one? So we are delighted for anyone to come and join us who is interested in being involved. So if you want to be involved in GeNotes in the paediatric working group, then I'd suggest that you contact Ellie, who will be able to talk to you about what your subspecialty interest might be and how you might want to be involved in the GeNotes working groups. And as Amy said, we would remunerate you for your time. If you want to be involved in GeNotes more broadly and do that via the Genomics Education Programme, then please get in touch with me. We often have fellowships that we put out to advert. We've actually just interviewing for some fellowships at the moment, but we regularly have them, and they can be done as an out of programme for experience, or we can do them as a secondment or a fixed term contract. So they regularly come up. There are also other things that we have something called the EDGE Group, Expert Developers of Genomic Education, that you could be involved in many different Genomics Education Programme resources, and we can pay you for your time via this EDGE Group. So we have two massive open online courses that we've just created and launched. One is mapped to the rare disease pathway, and we did that really on the piggybacking on the expertise of paediatricians and clinical geneticists around the country through this infrastructure of the EDGE Group.
Brilliant, thank you very, very much. And then I think possibly the last question that we have here is, can you tell us a little bit more about the app for GeNotes?
So should I do that one? Is that right? So we have recently, so at the moment, GeNotes is available on a mobile-friendly web interface, but we have anecdotally heard that people would find an app very useful. So we went out to our groups to ask whether or not they would find this a useful adjunct to this mobile-friendly web platform. And the overriding response was yes. And actually an app does have additional functionality. So it enables you to save you can log in and save certain aspects of the resource and really make it very bespoke to you. So we are at the moment applying to be able to do that. We have something called DTAG that we have to go via. But we hope that we will get approvals for that and that an app will launch in hopefully the first half of this year.
So one of the other questions that we've had is, does HEE anticipate working with other equivalent organisations in the UK nations to ensure this resource is equally useful in all areas, for example, where test directories may differ?
Yeah, so we are currently working with the devolved nations. I assume that's what the question is about. So we have an active working group to ensure that what we are developing is also useful in the devolved nations, and the test directory is different, but we are linking out to the relevant directories within Wales, Scotland and Northern Ireland. So it's a very active bit of work.
Brilliant. Thank you very, very much. I think we've come towards the end of our of the questions that have been posted. Are there any final words that you'd like to share before we end the webinar?
Just to say thank you to everyone for joining, and we really hope that we've whetted your interest in GeNotes and in genomics, and we've persuaded you that this is the most exciting thing we think that has hit medicine for many, many decades. So please do get in touch if you'd like to be part of this, if you would like to contribute to the development of any resources, and thank you very much for listening.
Brilliant. Thank you very, very much. A huge thanks again to Professor Kate Tatton Brown, Dr. Ellie Hay and Dr. Amy Frost for their brilliant presentations, and thanks to everyone for joining us today. We have posted a link to the evaluation form in the chat and would be very grateful for your feedback. We'll also share a recording of today's webinar by email, along with a link to the evaluation form and any other useful resources. Thanks again for joining, and we hope to see you for a future RCPCH webinar. Thank you.